Hello, and welcome to the tools section of this workshop. In this section, we are going to go over a tool that hopefully will really help your students as well as new hires. You have a template that is empty, meaning that you have areas that you can fill in and cater to your needs in your department. I'm going to show you the one I made for neurosurgery. We're first going to go over that one. And then we're going to go over a PowerPoint on how to target each section in the template. I want you to think when you're looking at this, you can do this, okay? This is made for you to contribute your ideas, contribute your knowledge, and organize the learning for your student. I want you to think as you're making this, how will this help my student grow and learn? Or my new hire, if they were to be in this, your new hire is in that job, how are they going to learn the best over the next year? I made this template over the past 6 months. I made it with a number of collaborators. One, Heidi, who's going to go over a section of the template because she was the originator of that. And then I also collaborated with some ortho APPs during shelter in place for some ideas for how to enhance the experience of new hires. I want you to feel like you're creating something that has longevity, that can be more eternalized, meaning you're making it. It is useful for year after year, and it can be collaborated on as well as edited over time with feedback from your students or your new hires. You're going to look at this section, and if you're in a group of APPs that has a number of APPs who are also taking this workshop, they might think, oh, okay, how are we going to do this? This seems like now it's turned into a team project. Maybe it has, right? So maybe you say, you do this section, I'll do this section, let's divide the work. We'll be done quicker, we'll have a great product, and we'll be able to utilize it sooner. You also may find in your large group of APPs that you guys do really different things. You may find if you're like the APP group in child neurology that I work with, we have APPs who work in neuro-oncology, particularly with epilepsy, general neurology, and then some APPs who work inpatient as well as outpatient. So you have this variety of settings, variety of skill sets, and patient populations. In that circumstance, having one guide for all of that doesn't make a lot of sense. So you're going to end up having some of the framework being the same, diagnoses different, and the expectations of your student or your new hire to be very different and targeted to those specialties. So work with your group. If you want to look this over, pause, think about it, discuss before moving on, that's fine. If you want to keep watching these videos to get a general overview and feel comfortable like, oh, okay, we can do this. And you can feel like you can dive ahead because you maybe are able to in your subspecialty, that's also fine. This is set up in a way that hopefully you'll be able to accomplish this over weeks if you need to, or possibly in one setting. And I'm gonna target the things that I really want you to get out of the time you have, because I know your time is limited. But I do know that this is a guide that should help you in the long run. So you put your work in up front, you will see benefits. Here we will go with an overview of the guide that was made for pediatric neurosurgery. You have a copy of the same guide, and it's a blank template in your workshop documents. The first page is a general information page. Here we have our cell phone contacts of the main APPs. This guide was meant for APP learners, so if you want to create a guide that's meant for other students, such as if you ever have a nurse or if you have a fellow or a resident that's spending time on the rotation and you want to make it nice and broad and accessible to multiple learners, you may include a larger subset of contact information and resources. As this was created for APP learners, we have the APP contacts provided. But for those students who come on with us who may need administrative contacts as well, we may include them or our attendings. Here are some resources that would be helpful for this rotation. Other things that could be helpful could be addresses or a map. For neurosurgery, there are multiple technical skills that may be acquired for the APP. Not all of these skills are required, but it's important to mention these skills. For imaging is very important for neurosurgery. And if in your specialty you have different important skills, or imaging or diagnostic tests, you can put them here. Some of these could be important lab work and how to interpret them. This is one of my favorite sections. The diagnoses section keeps everything much clearer for the learner. They're able to get the broad overview perspective of your rotation. We're talking about areas of medicine that are so subspecialized that many of our learners have not learned much of this at all in school. When they come to us, they are eager to learn, but they aren't always sure how to guide their learning. Henceforth, a guiding tool to help them, right? And there's no better way to guide them than with diagnoses. You can assign them a few different diagnoses to work on. You can use that for research and homework. It helps them understand that by the end of this rotation, I do hope I know these diagnoses. If I don't, I can read about it if I haven't seen these diagnoses, but this is a part of my subspecialty that I should know about. This section is called clinical competency. This is so the student, when they leave your rotation, they know they've gained some competency skills. If you heard all those students say they want guided autonomy, they want the ability to practice their skills. When they write down that they have observed these cases and done a history and physical, and they're able to do these following things in a verbal assessment with you, then they know they've guided their own learning and they're able to participate in the role of an APP in that position for these main diagnoses. This is supposed to help the student to feel like they have a level of competency that they didn't have when they first came in. We'll go through the other diagnoses that are included, including craniosynostosis, hydrocephalus, carrioma malformation, and myelomeningocele. This might be something you want to talk about in your group, what you think the major diagnoses would be. Or if you're somebody who is only in your role as an APP, you may be able to think about that clearer. Case studies. Case studies are a wonderful way to learn. They help guide the student to thinking about clinical reasoning, and they allow you to hear how your student is thinking. If you put together this guide and you have case studies too, your students can be very lucky. What I would recommend is after you finish your case studies and you have your answer section, you may want to keep your answer section separate when you give your student the cases, so then you can go over them on your own time with them later and have them work on the cases on a separate document, researching and thinking the cases very much through. Then you can compare your answers with them and offer them another opportunity if they want to do any more cases on that subject. The last section, our notes section. This isn't really the same type of learning that we've just gone over, which is a lot of self-directed learning of the student, researching and looking at diagnoses, clinical reasoning, as well as assessing clinical competencies. The note-taking is that validation of their learning. Am I doing this right? Here's an example of a good note. How can I be that good? So that's that clinical modeling that you do every day as a preceptor. And the note is a solid form of that modeling. If these are good notes and the student replicates it, they're going to do well in this rotation. It gives them some goals to work towards and makes them more competent at their role as a student. Now we'll go over to the next section.
Welcome to our video workshop titled Define Your Specialty. This video is a short video designed to help springboard ideas taken from your everyday clinical practice and create an excellent student rotation experience from them. In this video, we will walk you through how to go about choosing your top 5 diagnoses from your own clinical area of expertise and design a program that will help your students and new hires stay focused on their key objectives. Let's face it, we are busy, very busy. Sometimes it seems daunting with the very idea of how to take on a student and incorporate their rotation into our practice. We think to ourselves, I want to take on a student, but I'm not sure what I can teach them. We ourselves are often intimidated by taking on students because we think that our area of expertise is so specialized that we have little to offer to a student who is trying to learn just the basics. What relevance can we extract from our own day-to-day operations for a student who is trying to apply their learning objectives? Are we just too busy? Taking on a student can seem like a big responsibility at first, but in the end, the rewards are far greater for both you and your student. These types of relationships make us all better providers, and that is the common goal we are all striving to meet. We have a lot to offer, and here's how we are going to do it. Break it down. As promised, these next few slides are going to walk you through a simple process of creating your own custom program. Number one, what we're going to do first is we're going to focus on 5 key objective areas, just 5. A good place to start is by picking your top 5 diagnoses in your clinical practice. Well, you might ask, Heidi, how do I do that? And so I have a few places for you to start brainstorming. First, let's look at your clinic schedule. Who is on there? Do you just see one type of patients? Maybe you only see transplant patients. Do some of them have more commonly related problems associated with their transplant? You see where I'm going. Who do you see a lot of? Maybe your clinical area is more procedure-based. Do you have 5 procedures that you commonly do? With those procedures in mind, what diagnoses are you treating? Most of us work as a team. Brainstorm with them. Soon enough, you should have your top 5 diagnoses written down, and these will end up being the foundation for the rest of your program. Number 2, choose how your student will observe your top 5. Will they do a detailed history and physical exam in clinic? Maybe they will observe some related procedures. For instance, we see a number of patients who have a straightforward atrial septal defect or ASD. And when I have a student, I love to give these patients to them. They will often participate in their pre-op appointment with us and our anesthesia colleagues. And then the next day, they will observe the treatment or the ASD closure in the cath lab. Maybe your patients are inpatients and they will be participating in the rounds with you. Also, students are masters of navigating resources online and can always look to the internet with your guidance, of course, for more information on particular diagnoses that they have encountered that they may have a hard time actually seeing in clinic. Number 3, choose how your student will demonstrate understanding of core principles. Can they explain clinical presentation and history findings? What unique characteristics does this diagnosis carry? What would you see on the physical exam? What are some of the appropriate imaging modalities? Are there other associated comorbidities with this diagnosis? What is the proper treatment, if any? These are great questions to ask of your student, and it will help them ultimately understand what it is that you are trying to teach them. Number 4, comments. You're going to be creating a document for the student to use and keep a log of their rotation that they have with you. This section will be for the student or the new hire to jot down a few notes or handy mnemonics that might help trigger their learning. And last but not least, let's make this handout. Each diagnosis that you have should have its own handout or log, if you will, that could include, and these are just a few suggestions, a simple photo or diagram of your diagnoses, a table for your observation for the student to keep track of, maybe another table of the core principles that you observed, and a comment section for the student to write down anything else to help them remember. To make this easy for you, we've created a few templates that you should feel free to use and modify to make relevant for your own practice. Here are a few examples. These that I'm showing now on the screen come from cardiology in the cath lab. We use these for ASD closures and commonly for observing pulmonary hypertension cases. And pediatric neurology also shared a couple of theirs as well. This last slide is a copy of our template that you could use so that you would just cut and paste this into your own form and make it relevant to top 5 diagnoses in your clinical practice. And there you have it. You now have all of the tools you need to create your own amazing clinical experience for your students or your new hire that you will be bringing into your own practice. Please feel free to reach out to us at the email address below for any ideas that you may want to share, or if you are stuck and would like some brainstorming help. The APP Precepting Committee is here for you, and we want to see you be successful. Thank you.